What all things you should know before you do a tummy tuck procedure? There are various components to this question. So let me divide them along. Things you should know about your body. Things you should know about the procedure. Things you should know about the surgeon who is doing your tummy tuck. Things you should know about the place where you are undergoing tummy tuck. Things you should know about what kind of recovery will happen and what is the support system needed. So if you know these things, you are very much prepared for your tummy tuck surgery and journey. So what all you should know about your body? You should know whether this is the right procedure for you or not. You should know whether you really want to do a tummy tuck or not. You should know whether there is excess skin which should be removed, and if there are stretch mark areas of skin which can be removed and how much can be removed. If there is loose muscle under the skin, whether it needs to be tightened, or if there is any hernia in the belly button or around the belly button. How much fat is excess under the skin and above the muscle? Is there any visceral fat or any fat around your organs which will not be removed in tummy tuck, and you should be aware of it. You should also be aware of whether all these organs, because they are displaced forward, is putting any pressure on your back. You should also know if you are fit enough for epidural anesthesia or general anesthesia under which the procedure will be done. So these are the things you should know about your body before undergoing tummy tuck or lipoabdominoplasty procedure. Then what you should know about the surgery itself. This surgery is one of the most commonly performed cosmetic plastic surgery across the globe. So much so that in India, every 1 in 4 middle-aged person is an eligible candidate for a tummy tuck surgery. It's a very standard, safe procedure which gives fantastic results. You should know that this has again certain components. A tummy tuck or lipoabdominoplasty procedure has removal of excess fat, removal of excess skin, tightening of the muscle sheath, correction of any hernia, redesigning of your and repositioning of your belly button, and closing of all the wounds. So how excess fat is removed? It's by liposuction. Does it make a difference if it is done through any equipment? No. Skill of the surgeon is the most important. Person who is handling the instrument, whether it is power assisted liposuction or ultrasonic liposuction or conventional liposuction, results depend on the surgeon. It's an art. Machine has nothing to do with how the fat is removed, how your body is shaped. Removal of excess skin and joining of the edges should be done. It's a very mathematical, geometric thing, I can say. Correction of gap between the muscles, loose muscles and hernia will be very well done by a cosmetic plastic surgeon, because he has 3 years of training in plastic surgery before the cosmetic surgery fellowship, and he would have done the general surgery training also, where he would have done hundreds of hernia repairs. That component also you should know. A plastic surgeon is a general surgeon first, and then a plastic surgeon, then a cosmetic plastic surgeon. So repairing hernia is a very basic surgery. So that also is a component of your abdominoplasty. Then you should also know how much tightening can your lungs and body tolerate. If it becomes too tight and you can't breathe at all, then you will be very uncomfortable. So we may have to give you little training for that before we do that. So these things you should know about the procedure. What all you should know about your surgeon? You should know his experience. He should be somebody who is doing tummy tuck procedures on a regular basis. He should be a plastic surgeon. How to check whether your doctor is a plastic surgeon or not? He will have a degree called MCH plastic surgery. Anybody who has earned with sweat and blood will not hesitate to tell that I am a MCH plastic surgeon when you ask it. Nobody will get offended. Don't be shy. They would have done MS general surgery before that. And most importantly, before that they would have done an MBBS. So please check MBBS, MS, MCH in plastic surgery, and if there is a fellowship in cosmetic surgery, that's an added advantage. And number of years of experience after plastic surgery, you make a rough calculation of how many years it would take to just qualify and then to gain that much of experience. You should vibe well with your surgeon. You should be able to connect with that surgeon, and he should be able to understand what are your needs, and he should be able to deliver what you have in mind, and he should be able to guide you through this journey properly. So he should have empathy, experience, and he should have ethical surgical practice. What all you should know about the place where the surgery is going to be. It's very important, because any cosmetic plastic surgery, I call it a zero error surgery, because all the errors that are possible can be prevented when we prepare well. So that reduces the chances of side effects, adverse events, complications to a minimum. If something happens by accidents, by chance, then we should have system to take care of that also. It should be a facility which is dedicated to you, neither a very tiny place where there is no facility, you are getting a good price. Please don't risk. And it may be a big corporate hospital with thousands of beds, but what is the number of people you are getting, what is the attention you are getting, how much operating theater timing you are getting, what kind of ward you are getting. You are going in a big hospital where you are one patient of the hundreds of surgeries done in a day. That also is not good. What you should choose is a place which is right for you, which is right for your tummy tuck. Don't fall prey for this big hospital or small price, discounted price and unknown place without any facility. Get your checklist ready and check. It should have an operation theatre which is modern, modular and very well sterilizable, in which cosmetic plastic surgery is going on a daily basis. Because not only the surgeon, his support staff, nursing staff, everybody is important. Anesthesiologist is important. So a place where regularly these things are going on is the safest place. It should have safety backup like ICU backup. Then the stay environment should be pleasant and private. This is not something which you would go to an environment like an airport and get this surgery done. You are doing this to feel better, feel good. So it should be a comfortable, discreet environment where you can recover pleasantly. There should be all safety standards, and the operation theater, the protocols, systems and processes should be very good. There should be a nursing staff like who will take care of you during the recovery, and all that is needed should be available. If all the boxes tick, it doesn't matter which place on earth it is, you can very safely do your tummy tuck surgery. So just to recap, these are the things you should know before you do tummy tuck surgery. Things about your body, things about the procedure, things about the surgeon, things about the place where you undergo the surgery, and the support system that is needed after the surgery.